Hello, my name is Bailey Mars. I work as a blood and marrow transplant nurse coordinator and very interested in blood cancers and what causes them. My presentation today is regarding the chemical benzene and the risk of developing either MDS or AML after exposure. MDS, sometimes referred to as precancer, is actually a cancer diagnosis as it is a malfunction in the blood-forming cells of the bone marrow. Some patients with MDS can live with the disease for many years and with monitoring live a fairly normal life. However, at some point in the person's diagnosis, the body will no longer be able to cope with the damaged blood cells and further damage will begin to occur, leading to an acute phase or AML. In about 1/3 of patients, MDS can progress to a rapidly growing cancer of bone marrow cells called acute myeloid leukemia. AML, or acute myelogenous leukemia, is a serious form of blood cancer in which the bone marrow is taken over by cancerous cells and the body no longer produces normal functioning blood cells, which is not compatible with life. The only known cure for both of these diseases at this time is high-dose chemotherapy, sometimes with radiation, followed by a rescue of donated stem cells, which can come from a variety of sources. Benzene is fairly common in the environment and is found in car exhaust and cigarette smoke. Those at highest risk for increased exposure are persons who work in industrial factories such as those that produce petroleum. However, exposure can also be higher in those in enclosed spaces with unventilated fumes from gasoline, glues, solvents, paints, and art supplies. Areas of heavy traffic, gas stations, and areas near industrial sources may also have higher air levels. Cigarette smoke accounts for about half of the exposure to benzene in the United States. Benzene levels in rooms containing tobacco smoke can be many times higher than normal. People can also be exposed to benzene in contaminated drinking water and some foods, although the levels are usually very low. Exposure to this chemical may result in changes in cell growth and proliferation, leading to MDS or AML. Research and data on MDS has just recently been collected and recorded, with an estimated over 15,000 cases of MDS per year in the U.S. alone. The leukemia numbers are even higher, with an estimation of over 60,000 people being diagnosed with the disease in 2016. There were approximately 42,000 cases in males, averaging over 8,000 per year, and 33,000 cases in females, averaging over 6,000 per year. Although both of these diseases have a potential cure, it is not guaranteed, and the long-term effects of chemotherapy and radiation, as well as possible complications from a hematopoietic stem cell transplant, can obliterate a person's quality of life. In addition, according to research by Linus et al., the cost of simply induction therapy for AML, not including any follow-up treatment, potential relapses, additional hospital stays, etc., is over $62,000. Because of the risks, it is recommended that workers who are routinely exposed to benzene have blood counts and physical exams on a regular basis. In Study 1, the researchers conducted a nested case control from previous cohort study involving petroleum distribution employees. The researchers looked at the petroleum distributors as it was thought that their exposure would be the lowest in comparison to other workers in the industry. The level of exposure was measured using a quantitative estimate based on the worker's job duties, as well as the length of time the worker was employed in the petroleum industry. The outcome of leukemia was measured by medical diagnosis of disease. In Study 2, another case-controlled study, the researchers looked at benzene in comparison to other chemical exposures and the diagnosis of MDS or AML. Benzene exposure was measured by self-report, and the outcome of MDS or AML was measured by death certificate and cancer registries. Lastly, Study 3 was conducted as a nested case control, looking again at petroleum workers. This study measured the exposure of low levels of benzene by taking work histories, site-specific information, and an algorithm for petroleum industry monitoring data. Again, the outcome of MDS or AML was measured by medical diagnosis. The results of Study 1, the cases in this study were chosen from a previous cohort by death certificate or cancer registry and were then paired with 4 controls. Several different exposure risks were evaluated. The 3 I found most relevant were cumulative benzene exposure, maximum intensity of exposure, and years of employment. It would seem that the higher and longer the exposure, the higher the risk of AML. However, as you can see by the data provided, the odds ratio do not increase with increased cumulative exposure, as one might have assumed. The researchers also concluded that the risk for all leukemia consistently doubled in subjects who were employed for greater than 10 years. However, the risk for AML was highest in those who worked for a short duration and experienced low cumulative exposure. Although there is evidence to suggest the connection between benzene exposure and AML, the researchers were unable to determine a strong correlation between cumulative exposure, maximum intensity, and years of employment. They have suggested further research be done to review the work histories of study subjects, as well as develop ranges around the exposure estimates in order to enable sensitivity analysis. In Study 2, the researchers looked into associations of multiple chemicals and MDS or AML. However, their research found additional support for benzene exposure and MDS or AML. Specifically, benzene exposure greater than or equal to 5 years was significantly associated with AML and MDS, and benzene exposure less than 5 years was associated with just AML. Also, in recent years, low-level benzene exposure has been highly associated with MDS and may be the more prevalent outcome of benzene exposure. The conclusion was made that an attributable fraction for benzene exposure ranges from 8 to 16%, although additional study was suggested because the majority of cases in the study did not report exposure to any chemicals. It is also mentioned that most of the studies regarding benzene and cancer are conducted in the petroleum industry. Lastly, in Study 3, the researchers found that their research subjects had worked the longest in an airport had nearly 4 times the risk of leukemia compared with terminal workers, but this result was based on small numbers. A strong correlation was found between exposure to benzene concentrate and leukemia risk. Leukemia seems to be associated with lower cumulative exposures than has been observed in other studies. The estimated cumulative exposures were generally similar to those reported for other petroleum industry studies, except that the most highly exposed subjects in our study had cumulative exposures of less than 60 parts per million years, whereas those in other studies were as high as 220 parts per million years, according to Glass et al. The significance of this study is the result that even low levels of benzene exposure can lead to a cancerous diagnosis. Based on Heineken's criteria, all 3 articles showed some statistically significant data, including parts per million years of benzene exposure and MDS versus AML diagnosis. All 3 articles, being case control studies, were at risk for selection bias as well as recall bias due to using subject self-reported history and work experience. Study 2 was at risk for survival bias because some of the information was obtained from death certificates. In all studies, confounders such as age and gender were controlled. There are several other factors in which the individual studies focused on controlling, including socioeconomic status, cancer history, family history, household income, alcohol, and tobacco use. According to Article 1, there is a moderate association between 4.5 to 44.9 parts per million years and cancer diagnosis, as well as moderate to strong association with increasing years of employment. Study 2 shows a strong association between benzene and AML and a moderate association between benzene and MDS. Lastly, Study 3 shows a strong association with any benzene exposure over 1 part per million years. The Heineken criteria for the 3 studies shows a strong case for causality. A statistically significant and moderate to strong association between benzene exposure and MDS or AML was demonstrated in all 3 studies. Benzene has also been known to cause cancerous diseases such as MDS and AML for some time. There has been abundant research regarding chemical exposure in cancer diagnoses. After reviewing the aforementioned articles, there is a significant association between benzene exposure and MDS or AML. Interestingly, there is a higher incidence of MDS with lower levels of exposure. This seems to suggest more research should be done surrounding MDS, its causes, treatment, and prevention of progression to AML. There is obviously a need for further investigation and thought regarding the use of benzene, as well as protecting the population and environment from its harmful effects. Thank you for listening.